Hi Steve, this is a impromptu presentation because we can't meet yet, maybe later soon. This is about getting started prescribing videos to patients, your patients or Valley Emergency Room physicians, patients, nurse practitioners, etc. We both understand communication is a huge part of quality healthcare, quality interaction. A chance to lower liability by having better communication is part of what this is about. In general, it's the model I embrace for good medicine. Pardon the not too professional aspects of some of this. It's just thrown together, but I had the stack ready. The idea, we make videos and we make it easy for people to prescribe videos, doctors, health practitioners of all kinds, and usually there's a message. Big one, partially it's branding so people know who their doctor is. Partly it's the idea, you know, if you want to say you've had a head injury, these are the things to expect. I want this video to be looked at by people in the family, or you've got a geriatric patient who has now congestive heart failure. You want to make sure the person doesn't get sodium. Whatever the message is, to communicate to that patient and the family around them. If they're capable of viewing the internet, they're capable of watching these videos. So the idea is we can send you a quote for making them for your physicians. In your case, the logistics is a big deal, but it could be a partnership between Health Video Services, a company I started with Ben Goswami, just the two of us at this point, and Valley Emergency Physicians. We're just getting started doing this, but I think it's very real. Just getting started, meaning it's a couple years in the process of getting to this point. We've got the technology pretty well down. We've got so we can do this as we needed. So I can give you a quote in a minute what things may cost, but here's an idea of what I've done. This is an example of a video I did as a branding video, letting patients know that I'm very nutritionally oriented and communicating the message I always had to communicate to them, which is you've got to be taking vitamin D if you live in Northern California because you're not getting enough ultraviolet B radiation. And the other one is sugar. This one specifically just you can't have too much glucose in your diet because it turns into sugar and turns into de novo fatty acids, but in terms that they understand. So we're going to see what rice is about, and when you eat rice, what the real meaning of that is. In this bowl here, I put 200 grams of rice. 200 grams. This is about what a person might eat in a day or so, maybe 2 days. 800 calories, approximately. 800 calories of rice. By 200 grams. This is the equivalent amount of sugar you're eating when you eat this much rice each day. Very good. I had to go to the punchline because I teach everybody this, but that's a branding video. It costs a little bit more than the other videos like the one I'm making now, which is just a screen capture video. I usually use PowerPoint presentations or keynotes to do those. Keynote is the Mac version. They cost between $250 if we did just one, or $200 each if we did a number of them. If we could set up a location for filming and film a number of doctors, the price could drop. The idea is not just to provide the video, just to produce the video, but to coach the doctor into getting it into 3 or 5 minutes as a communication that is very important and is accurate about medical, that's pertinent to medical care. And it can be used for front office work as well, messages that are given all the time. You know, you've got somebody with high cholesterol, you want to say, yes, these are the things you can do. No, we don't want to do medicines yet. We want to check you in this number of time, etc. Teaching and, oh, yes, what we do for referrals is A, B, and C. So people don't have to answer the same questions. Video capture is very powerful. I think you'll remember this video when you see it. Here's an example of one I did for narcotics. There's a longer video on narcotic use. This is the shorter video. Narcotics are scheduled medications. That means there are some restrictions on their prescribing. I frequently prescribe a Schedule III narcotic like hydrocodone with acetaminophen, known frequently as Vicodin or Lortab. I go on to say, look, you get constipation if you keep taking. There's a problem with obtundation. You know, so we can say specifically what your risks are, risk profile, and specifics about our policy or whatever. So the idea is repeated teaching that is a waste of time, not a waste of time, but unfortunately can't be done within the time context we have. Now is better partially done, especially repeated messages on video. They're reinforcement messages. They lower liability. They can increase efficiency. And, you know, we're in a competitive state, so this is a added value for the patients and to sell to hospitals. The idea will be that Health Video Services also has a landing site for the patients where they can keep the videos of the physicians they use and their practitioners, their dentists, their veterinarians, their chiropractors, their primary care, their specialists, and then some family members who need to see access can see who the physician is immediately through a little video to understand what their role is in the care of that patient. So we're hoping to expand to that realm and eventually to be able to use videos in the context of telemedicine, where both patient and physician will be viewing a video and interrupt as it moves along, kibitzing or being explicit about how this applies to the patient or what expectations are. So an enhanced communication model. In general, when we sell these videos to the public, it's the idea that this should enhance communication with your practitioner. It also just provides better communication. Thanks. I hope to see you soon. Good luck working. Here's the numbers if you want to look at that again. We do this, we do the editing, we do the posting, we give people access so they can just prescribe the medicine for a year at that cost. We're trying to keep the cost of hosting down, which is easy to do because it's not expensive. We're trying to grow the model rapidly as we can and you know, incorporate as many physicians as possible. Valley Emergency Physicians could be a particularly good fit. Okay, here's my phone number and my email, rmlorenzato@gmail.com. Probably works better than other ones. See you later. Bye.